The former newsreader Michael Burke has propelled himself into one almighty row. In a Radio Times article, he says that the state should leave obese people alone, as their early deaths will save the NHS money in the long run. He's also been criticised for saying that overweight people should be allowed to indulge if they wish, and that if they are not ill, they are simply weak. Joining me to discuss their response to his comments are Kat Henry, a plus-size blogger and a Miss Great Britain finalist, and Daniel Pryor, head of programmes at the Adam Smith Institute. I mean, you may not choose Michael Burke's particular language or sentence structure, but do you think he has a point, Daniel?
Yes, I do. I think his use of language has just been gone over. It leaves a lot to be desired. But his point on the net cost of obesity to taxpayers is broadly correct. People, as morbid as it sounds, they do die earlier, so they take out less in state pensions and they suffer from less costly health conditions. There's good evidence, good peer-reviewed studies to back this up. But he was also right to emphasise that living long isn't the only thing that matters. It's not just about how healthy we are. It's, as your other guest was saying, about enjoying yourself and enjoying life. I mean, I eat too many takeaways. I know that they're bad for me, but I do it because I care more about having tasty food than I do about living until I'm 100. And I think that emphasising that kind of personal responsibility and personal choice is ultimately correct. He was right to make that point.
On the other hand, hasn't obesity been classified as a disease, an illness, a little bit like alcoholism, an addiction, a problem, something that, you know, needs medical intervention? We know that there's a growing trend towards bariatric surgery, so gastric bands and bypasses and sleeves and things like that, to try to help people solve what for many seems to be, at any rate, an insurmountable problem. They'd like to stop overeating, they just can't do it.
So I think it depends on the individual. In some cases, yes, there's kind of genetic or heritable factors that make obesity more likely. Other times it is just a lifestyle choice. And if you look at, for example, the obesity rate from the 1970s, it's been gradually creeping upwards. And the reason for that isn't because we're eating more, it's because we're exercising less. It's very much a lifestyle choice, and it comes to our more sedentary lifestyle, sitting more in offices like I do every single day. But even if there was a significant net cost to the NHS from obesity, there's this kind of perverse logic in trying to force overweight or obese people to change their behaviour for the sake of the public purse. The logical conclusion of that is that we should all be forced to eat kind of tasteless nutrient packets in order to save the state money. There's more to life than simply being healthy. It's also about having fun, having a nice meal if you want to.
However, people who are not healthy and listening to this, afflicted by an illness or an ailment or something that hurts, will think, what do you mean there's more to life than being healthy? All there is, really, is being healthy, because if you're not healthy, you can't enjoy any of it. You can't enjoy the sun on your face, you can't enjoy a good joke. You're in pain. It's not a good place to be unhealthy.
Well, there's shades of grey here. I mean, towards the end of my university exams, I ate, again, way too many takeaways, put on a bit of weight, didn't feel as healthy, but I still enjoy those takeaways. It might be that if you have a particular condition, then yes, of course, you should be treated on the NHS. You should speak to your doctor and get advice about that. My point is just that for most people in the country who are able to manage their weight through lifestyle choices and things like that, it's down to them, and they should be equipped with the tools to manage their weight. And yes, if they want to, eat unhealthy food sometimes and face the consequences that they're completely aware of anyway.
I don't think Michael Burke's trying to stop anyone doing it, is he? He's doing the opposite. He's saying, go on, do it. Eat as much as you like. You'll die young. That'll be fine. That'll be sort of natural selection. It'll free up NHS beds for those people who've managed to keep slim during their lifetimes. But I think some people listening may just think, my gosh, I have tried so hard to control my weight. You are dismissing me as weak, lazy, greedy, and all things bad. Actually, I'm none of the above. I've been afflicted with the serious illness of obesity, and it's dominated my life, despite my best efforts.
Yeah, and as I said, I don't think his use of language was ideal, and I wouldn't kind of blame people for their own weight in that way. But I think what he's doing...
I've got to say that when you write an article, you have chosen every word you use. None of it's accidental. It's not that he, by mistake, chose these phrases.
No, for sure.
He's carefully constructed these phrases, hasn't he?
He has, and I think he's stoking controversy and using sarcasm to a certain extent. That's certainly my reading of it when I first came across the article. But ultimately, he's pushing back against this kind of what is often perceived as nanny statism that's been coming over the past few years, and the people that are trying to control our lifestyle choices through things like the sugar tax or banning buy one, get one frees in supermarkets. And rather than informing people of the risks of being overweight, they're using a kind of cudgel to try and force them not to be overweight. And I think it's good that we're getting some pushback against that.
Thank you very much, Daniel. So lovely listener.